Hello everyone, this is Dr. Saloni Jaiswal. Today's topic will be the muscles of mastication. Today we'll be discussing the muscle of mastication in a very brief manner. So now let's start with it. What basically are the muscles of mastications? Like, they are the muscles which are present in our oral cavity, and they help us to bite our food, chew our food, and provide an ease in mastication and digestion of the food. Now, they are the group of four paired skeletal muscle that move the mandible at the TMJ or the temporomandibular joint for chewing, biting, and grinding our food. They are divided into four, like they are masseter, temporalis, medial pterygoid, and lateral pterygoid. And all of them are innervated by the mandibular division of the trigeminal nerve, and they are derived from the first pharyngeal arch. Let's continue with the very first muscles of mastication, the masseter muscle. This is the strongest muscle of the body and also the strongest muscle of mastication. It is quadrilateral in shape and it covers the lateral surface of the ramus of the mandible. It has basically three layers: the superficial layer, the middle layer, and the deep layer. Let's discuss the origin of this muscle. The superficial layer originates from the anterior two-thirds of the lower border of the zygomatic arch and the zygomatic process of the maxilla. The middle layer, it originates from the anterior two-thirds layer of the deep surface of the lower border of the zygomatic arch and posterior one-third of the lower border of the zygomatic arch, and the deep layer from the deep surface of the zygomatic arch. Now, they insert all of them, the layer, the superficial layer, it inserts into the lower part of the ramus of the mandible, the middle part into the middle part of the ramus of the mandible, the deep layer into the upper part of the ramus of the mandible. Now the nerve supply, like they are innervated by the masseteric nerve and helps to elevate the mandible to close the mouth for biting. Now the temporalis muscle, it is a fan shaped muscle and it covers the temporal fossa. It originates from the undersurface of the temporal fascia and the temporal fossa, excluding the zygomatic bone, and it inserts into the deep surface of the coronoid process of the mandible and the anterior border of the ramus of the mandible. They are innervated by two deep temporal nerves, which are the anterior division of the mandibular nerve. They help in elevating the mandible, protruding the mandible, that is, protrusion of the mandible in a forward direction, and side to side grinding movement. Now, the third muscle of the mastication is the lateral pterygoid muscle. So they are the masseter muscle and the temporalis muscle. They were the muscles which helps in basically elevating the mandible, elevating of the mandible to close the mouth for biting, grinding, function, etc. Now let's continue with the third muscle, that is the medial pterygoid muscle. So medial pterygoid muscle, it is also quadrilateral in shape and has a small superficial and a large deep head. And as it start with the medial pterygoid M, so we can help to close the mouth. So what is the origin of the medial pterygoid? It has two head basically, the superficial head and the deep head. Superficial head originate from the maxillary tuberosity and the deep head originate from the palatine bone and the adjacent part of the medial pterygoid plate. Now both of them insert at the roughest part of the medial surface of the mandible or the ramus surface of the mandible. The nerve supply, nerve to pterygoid from the mandibular nerve. Now, what is the action of the medial pterygoid? It's like it helps to elevate the mandible. It protrudes the mandible with lateral pterygoid of the same side, conjugate movement with medial pterygoid of the opposite side, and clenching of the mouth. Now, let's come to the lateral pterygoid. It helps us to open the mouth. It is short and conical and has upper and lower head. It also has two head, the upper head and the lower head. Upper head, it originates from the infratemporal surface and crest of greater wing of sphenoid. The lower head from the lateral surface of the lateral pterygoid plate, and it inserts into the pterygoid fossa. The upper head and the lower head. Here also the insertions are different. Like the upper head gets inserted into the pterygoid fovea and the lower head inserts in the anterior margin of the articular disc. And now the nerve supply of the lateral pterygoid is gets supplied from the branch of the mandibular nerve, and its action is basically to depress the mandible, to protrude the mandible with lateral and the medial pterygoid of the opposite side, and the conjugate movement. Here's a very clear picture which helps depict the presence of masseter, temporalis, medial pterygoid and the lateral pterygoid muscle. Hope this will help you to recognize the muscle, to learn it in a very better way. Do like, share and follow my channel. Thank you.